Hello, everyone. My name is Cindy Lord, and I want to welcome you to this Aquifer webinar. I'm an associate professor at the Case Western Reserve University School of Medicine, a primary care PA educator, and chair of the Aquifer PA Educator Task Force. Before we dive into how Aquifer can help, let's dig into some of the common challenges in teaching didactics. As you probably experience, some of the common challenges to teaching didactic include bridging the gap between didactic and clinical. Oftentimes, busy clinicians in local health systems or private practice do not have responsibility for formal lectures or didactic activities, and there's a disconnect between the learning that takes place at clinical sites with community-based preceptors and the information from cases or didactic lectures that core faculty present to students. Additionally, material might not feel engaging for students, as it might be too theoretical or sometimes too redundant, and the varying amounts of experience amongst the students can lead to disinterest. You may find you can't get through all the necessary content in the classroom. And one of the biggest challenges we all face is having enough time to find or write cases for a CBL or a PBL session, and then planning a classroom session on top of that. For those of you who may be new to Aquifer or may be looking for a refresher, Aquifer cases walk through the process of a complete patient encounter with new content revealed at each step. Each case provides the student with an opportunity to practice identifying the important findings of the history and physical, create and stratify differential diagnoses, identify their working diagnosis, create a concise summary statement about the facts of the case, and commit to a diagnosis and treatment plan. A helpful refrain for you may be to consider Aquifer cases as a standardized patient. We know that standardized patients can help students practice clinical patient care skills. Deliberate practice allows more time to dig deep, understand, and get feedback. With the wide breadth of Aquifer content available and the searchable content library, it's easy to find just the right case or patient for you to get to know and to incorporate into an activity with your students. Some benefits to using Aquifer include active learning sessions ready to use that are developed by experts and easy to adapt and make your own. Engaging students around the story and talk it through like a real patient. It gives an opportunity for preceptors to engage in discussion with their students about what was covered during these activities. It allows for creativity, like using the flipped classroom model, which keeps material from feeling redundant, and learners appreciate the case-based learning and pragmatic application of specific clinical tools. And finally, Aquifer helps with skill development and knowledge application. So now let's take a look at the principles in action with examples of how you can use Aquifer in your didactic curriculum. Building confidence and competence in students during the didactic component of the curriculum is a challenge for all PA, NP, and medical educators. This challenge is compounded by our desire to integrate more active learning strategies to better engage students and demonstrate the relevance of didactic curriculum to clinicals and ultimately to their career. The PA Educator Task Force was charged with looking for new ways for PA educators to leverage Aquifer to support their students. Our goal was to make it more efficient to connect PA educators with Aquifer content, tools, and resources to help them teach content that's difficult to teach. What we came up with is a keyword guide. It's easy to use. It's got a friendly design with two versions, a PDF and an app. It's searchable, and it can be used throughout the didactic curriculum. With close to 70 keywords, it can be used in all aspects of the didactic curriculum. The keyword guide was initially designed with PA educators in mind, but with the inclusion of keywords from the major areas of didactic curriculum, including basic science, clinical skills, clinical medicine, counseling and patient education, as well as clinical reasoning and critical thinking, this tool is quite applicable to NP and medical school curricula as well. Each keyword is mapped to PA accreditation standards and competencies of a new grad. But I would say to our NP, and medical educators on this webinar that you can easily see the association and similarity with the standards of accreditation and competencies of your own profession. For each keyword, the guide provides examples of Aquifer cases, then addresses the keyword as well as tips for curricular integration and teaching strategies. For example, the basic science section includes the keywords of anatomy, physiology, pharmacology, and genetics. If you were to use and search the keyword, say, anatomy instruction, you would find a teaching strategy that suggests using the integrated illness scripts to describe what goes wrong in various organ systems with your anatomy and or physiology classes. This will allow instructors to compare normal anatomy with disease processes. So an example would be in discussion of the GI system, say in an anatomy class, assign students to complete the GERD integrated illness script. Then in class, use the what's the UPI, fillable mechanism of disease map, to remind students to think about the role of anatomy. Both the UPI, underlying pathophysiological insult handout, as well as the mechanism of disease map can be found in the Integrated Illness Script Educator Resource section of Aqueduct. Handouts like these save educators time while providing them with quality tools that can easily drop into their curriculum. The guide includes keywords related to clinical skills, including performing a physical exam, communication skills, history taking, and oral presentations. So if we were to search the keyword physical examination, we would find a teaching strategy that suggests we use pediatrics case 32, which is a day in a pediatric dermatology clinic. And we can use this to teach students dermatology terminology and skin exam documentation. Have students work through the case as pre-work, and then have them work as partners in class to practice writing skin physical exam findings for lesions shown in the photos provided in the case. The guide also includes numerous keywords included in the curriculum for clinical medicine, social and behavioral sciences, clinical reasoning, working on interprofessional teams, as well as counseling and patient education. So if we were to search the keyword behavior change, we would find a teaching strategy that would have students complete high value care case number 3, internal medicine case number 8, and medical home case number 1, and they would complete that as pre-work. Then, using the pair and share method in class, you would have students create a behavior change for a patient using the 5 A's of behavior change, which is introduced in the high value care case number 3. Pairs of students will share their behavior change plans with each other. So student 1 would create a behavior change for internal medicine case 8, and student 2 would create a behavior change for medical home case number 1. Then the class could come back together to debrief. Now let's take a tour of the Keyword Educator Guide prototypes. I will begin with a tour of the Keyword app. So we use an app called the Glide app, and when you open up the app, you come to our homepage, where you'll see information just about the tool. And you can see there's a home button. You can search for words using major buckets or major competency areas like health literacy and communication, or interprofessional collaborative practice and leadership, or patient-centered practice and knowledge. So when you click on it that way, you'll see the keyword, and then you can click on that keyword and you'll see it expand out with lots of detail. Probably the easiest way is to use the keyword search feature. So for instance, if I were to search for the term, let's look at medical basic science. And I see that a number of things come up, and one of those is instruction in medical and basic science. So we see that our keyword is listed, instruction in basic and medical science. It lists the PA accreditation standard number. It then defines that standard. It lists the actual standard. It then lists the domains for the PA profession. And again, to my medical and NP colleagues, I would say that these probably closely parallel your competency and domains. And then we get into teaching strategies. And you'll see here that one of the suggestions is to use the Venn diagram activity card in the Integrated Illness Script Sciences section, their resource guide. And in that activity, students will study sibling integrated illness scripts before class. You'll identify a common clinical feature. So for example, here we use asthma and pneumothorax have dyspnea as a common clinical feature. And you'll ask the students to draw a Venn diagram from memory with the core concepts from each of the integrated illness scripts for that feature. Then you ask them to return to the actual integrated illness scripts and study how the mechanisms differ for the clinical feature in each script. You can do the activity with the entire class, or you can actually break them down into groups. After your teaching strategy, we actually list a number of exemplars of Aquifer cases that could be used with those teaching strategies. And for most, you'll see that it starts with a statement that says multiple cases can be used. So instead of listing all Aquifer cases, we've pulled out some of our favorites. And we list for this example, we list the integrated illness script, diabetic ketoacidosis, and then we list the actual science that's affiliated with that integrated illness script. After that, we list the PA core competencies for new grads that are associated with that keyword, instruction in basic medical science. And then what's really neat about the app is that it's kind of like crowdsourcing. You can share your own ideas. Maybe you have a new teaching strategy. You want to comment on the teaching strategy. And so that can be added right into the app at the time of use. And with the app, we also made available other search terms. So if you searched anatomy, you could come up with the same keyword and find that teaching strategy. If you searched physiology, it'd come up. So you have multiple different words that are similar, search terms that could be associated with instruction in basic medical science. Now let's take a look at our second prototype, which is a PDF version of our keyword tool. So here you'll see we start with our keyword guide, and we come up to the first 2 pages are set up like a typical PDF with a table, like a booklet or a resource guide with a table of contents. And so let's look down here, and it has the search tool. We can use the search tool of a PDF, or at the bottom of each page, you can also get back to the table of contents. And so if you go to the search tool, and let's type in, how about interpersonal and communication skills? And let's see what comes up. Oh, there it is. So there's that's the first search. So let's take a look at it. So you just click on it. And similar to the app, you're going to get a one-pager. It has the keyword listed up top, interpersonal and communication skills. With the number, it gives the definition of the ARC standard. It has the core competencies. It has a list of Aquifer cases. So here we see oral presentation skills, case 1, 2, 3, and 4, geriatrics case. And then as you scroll down, it has the integration strategies. So for this keyword, interpersonal and communication skills, one of the integration strategies is to have students complete Aquifer Family Medicine case number 13, which is about asthma, or geriatric case number 2, which deals with an elderly diabetic patient. And you have the students create that as pre-work, and you put them into pairs. And in class, you have the students break into pairs, so one who's done asthma and one who's done the elderly diabetic patient. And what they do is you have them practice the teach-back technique on how to use inhalers to manage their asthma properly, or for the other case, how that elderly patient should take their diabetes medication and what to do in case of hypoglycemia. And again, once you're done with that keyword, you can just click on table of contents and it will bring you back. So you can either scroll through the table of contents, which lists the major categories: health literacy and communication, interprofessional collaborative practice and leadership, patient-centered practice, or you can use the search feature. So to summarize, the Educator Keyword Guide uses Aquifer cases to help meet accreditation standards, competencies, and learning outcomes. It easily brings active learning into the classroom. It provides a clinical connection to didactic curriculum, and it helps faculty learn to teach using high-quality clinical cases. For access to the prototypes, you can scan the QR code, which will bring you to the Glide app, or you can go to the link listed below, and you'll have access to both the Glide app and to the PDF. So in conclusion, I would like to say, try it. I think you'll like it. Thank you.